Well, authorities are seeing more and more drug overdoses, whether it's things like heroin or prescription drugs, and they are not just in the city. Now, CrisisCare and the Alcohol, Drug Addiction, and Mental Health Services Board of Montgomery County are trying to stop people from dying of drug overdose. Colleen Smith is with Samaritan Behavioral Health, and she joins us this morning with more on Project Dawn. Colleen, thank you so much for joining us.
You're welcome, Mike.
We
Thank
appreciate it. Tell us what Project Dawn is.
Well, Project Dawn is a program to help save lives, basically. In the Montgomery County area, in about the past 3 to 4 weeks, there have been 10 suspected opiate overdoses. And opiates can either be drugs like heroin, or it can be medication like tramadol, morphine, codeine, other kinds of opiate-based drugs.
10 deaths just in the past 3 or 4 weeks.
Yes.
Yes. In your opinion, is this problem just getting worse and worse?
It is getting worse and worse. And part of what happens is that each one of those people was somebody's friend, family member, child that died. And what we believe is that if the people who were around at the time could have known what to look for the signs of the overdose and had an overdose reversal kit, they might have been able to save some lives.
Okay, one of those kits you're holding right now. By the way, DAWN stands for?
Deaths Avoided with Naloxone. The drug that's used in here is called Naloxone.
Okay.
And so it has to do with reversing the overdose so that the person doesn't die. The whole purpose is to save lives.
This is the kit. Inside the kit is basically a lifesaver.
Right. There is a mask for teaching using rescue breathing. There is a booklet that explains how to put the syringe together. There is then 2 of these nasal atomizers, 2 tubes of medication, and then the syringe to be able to, it's a nasal inhaler, so you basically squirt it up somebody's nose if they're overdosing.
And again, anyone who gets one of these has to be trained.
Right, because you need to know what the warning signs are. It's real important that you call 911 whenever anyone's overdosing, because even the naloxone, the drug that we use in this, can only last 30 to 90 minutes. So a person could go back into the overdose and still die. So the important thing is to stop the overdose, make sure they're alive, call 911, and then when the ambulance comes, they can deal with whatever ongoing effects may be.
Heroin and opiate are such a problem in this area, but it's not just, like I said, it's not just in the urban areas, it's not just in the cities. You're starting to see it out in the countryside now, right?
Right.
Suburban
it's
areas.
In the suburban areas. There's a lot in some of the suburbs around Dayton, everything from Centerville and Washington Township to Huber Heights to Trotwood, all over the Dayton area. Unfortunately, Dayton's one of the areas in the state that has the highest growing rates of death, and it's not just the drugs, it's also the medication. In last year, the studies that have come out have indicated there were probably like 115 deaths that were related to heroin and 95 deaths that were related to medication.
So this is a lifesaver. This is prevention of to prevent a death on the one side of it, but most importantly, and just as importantly, on the front end of this is the education, the awareness, the not getting into it to begin with. So Project Dawn, just getting started. Colleen, thanks so much for telling us about it.
Thank
a good
you.
idea. For more on Project Dawn, go to fox45now.com. Just click on Fox 45 in the morning, and we do appreciate you coming in. Tell us about it.